Assalamualaikum everyone, welcome back to this channel. So this is me Alia Wahid, and in this video we are going to discuss about the anti-cough agents. So in the previous lecture we have discussed about the cough. We have discussed that what are the diseases in which you can observe cough as a symptom, and we have also discussed some drugs which are anti-cough agents. But now I am doing such some modification in that lecture and again explaining all the anti-cough agents. So here we have three classification of anti-cough agents, which are the anti-tussive drugs. Some are expectorant and some are mucolytics. Now first of all we will discuss the anti-tussive drugs. Actually, we have discussed in the previous lecture that the cough has two types. First is the dry cough, and second is the productive cough, or you can say as a wet cough. Okay, so now these anti-tussive drugs, these are the drugs which are used to treat your dry cough. You know very well, dry cough is a type of a cough in which you produce no mucus in it, and it is very harmful cough, so we have to suppress it. So the mechanism of action of anti-tussive drug is that it is going to suppress the coughing centers which are present in your brain. In the previous lecture we have discussed that what are the cough centers and where they are present. We have discussed that in the medulla oblongata we have some areas where these cough centers present, like in the cerebellum, like in the subcortical agent, in the cortical agents. These centers are present and we have to suppress them. So the mechanism of all the antitussive drug is that they are going to suppress these centers and the cough will be stopped. Now let's discuss the classification of antitussive drugs. So they are divided into the three groups. First, they are acting on in the peripheral area. What is mean by peripheral area means they are acting in your peripheral part of the body and help to stop the cough. Some are the drugs which act centrally, mean they are going to act on your brain, and inside your brain you know that cough centers are present, so they are suppressing the cough centers. And some drug also act on the brain, mean in the central area, also act in the peripheral area, having both actions. So now we will discuss the detail of all of these drugs. Like peripheral acting drugs include demusert and steam inhalations. And the centrally acting drugs, it again divided into the two groups. First is the opioid and narcotics drugs. Opioid and narcotics drugs are those drugs which contain morphine derivatives. So they have, you know that morphine and its derivative, they have sedative action. So they can cause you dizziness to all of you. So this is the side effect of these drugs. So the drugs include in this class is the codeine, phylocodeine and ethyl morphine. So they are all are the derivatives of morphine. But some are the drugs which are non-opioid, mean having no analgesic action. They will no cause sedative or dizziness action. They can also called as non-narcotics like desmomethorphan. These are some drugs. Now some are the drugs which can act centrally as well as peripherally, like benzonate and carbetapentane. These are the drugs which also act on your central areas of your brain, and also act in the peripheral area, stopping the cough of your body. Now starting the detail of every drug. So first of all we will discuss the peripheral acting drugs, and we will discuss the both of these types. So here the peripheral acting antitussive drugs are given. So first antitussive drug is the demulcent. Demulcent act on the peripheral area. What it is doing, actually it is a mucoprotective agent. What is mean by muco, mean mucus. Protective mean it is going to protect your mucus. Okay, what are the demulcents? What are the examples of them? So licorice or lozenges. Licorice is a plant, a root, which is used in order to treat your mucus or protect your mucus. Okay, and lozenges are also a type of drug which is very sweet in nature, and they are ingert into your body, and then they show localized effect in your throat, causing the smoothness of it, and also protect the mucus. So if the mucus is protective, then it's mean you will it will stop the cough. Examples are the honey, syrup, sweet syrups, and glycerine are one of the best example. Where is their action? So they act above the larynx, mean in the pharynx of your body. So in the pharynx, when the inflammation happen, then it is called as pharyngitis. Gitis means inflammation. So whenever the inflammation happens inside the pharynx, you will take honey, you will take serum, you can take glycerine and licorice and lozenges. So they will protect the mucus present in the larynx, in the pharynx, and give you a more mucoprotective and smoothness in your throat. Now let's discuss the second type which act in the peripheral area. This is called as steam inhalation. Means sometimes the doctor gave you a steam inhalant in which you boil the water, and simply you put that steam inhalant into this boiling water, and after that you will you will take the steam, and this steam will cause a localized effect in your throat, in your larynx, above the larynx or also below the larynx, causing the protection of your mucus and causing decrease in the inflammation. So what are these drugs? So they are causing localized effect only. And what is their action, that how they are producing? So they increase the concentration of mucus. So the more the mucus produce, more the smoothness occur in your throat, and your cough will be stopped. So in the dry cough, you know that no mucus is produced. By giving the steam inhalation, we are increasing the production of mucus. As the mucus production increases, your cough will be stopped. Now, what are the examples of steam inhalation? Menthol and camphor, they are the important steam inhalers which are given to the patient. Now, the peripheral acting antitussive agents are covered. We have discussed both of these types. Now, we are going to start the centrally acting antitussive drugs. So the first class which is included in that centrally acting antitussive drugs is the opioid drugs, or can called as narcotics agents. So the first example of opioid drugs is the codeine. Codeine is a morphine derivative. So morphine is going to be derived, some groups attached with it, and the codeine will form. What is the action of codeine? Actually, it is going to suppress the cough centers which is present in your brain. So it is acting centrally on your brain. Let's discuss the mechanism of action. First, it is suppressing the cough center. Second, it also acts on the beta 2 adrenergic receptors. These receptors are present in your lungs. Actually, after going to them, they will cause the bronchodilation of your bronchioles, and when the bronchioles dilate, mean it is going to increase the size of your bronchioles. Let's suppose this is a bronchiole. First, it has very small diameter. Okay, now when this drug goes, like this is the beta 2 receptor present on it, when the drugs bind with it, it increase the size of bronchiole, like I am drawing here. Let's suppose now the size of bronchiole increases. So that way, in this way, when this bronchodilation happens, the secretion of mucus inside the bronchiole will decrease. Okay, first it is very high secretions. Now as the size increase, the bronchodilation happens, secretion will decrease out, and cough will be suppressed. So this was the mechanism of action of codeine, but it has many side effects of it. So the doctors don't prefer codeine to give the patient, but sometimes they have according to the condition of the patient, they give codeine to that particular patient, so that the patient will go to sleep and the cough will not happen to him. So but mostly the doctors don't give codeine because of their side effects. Now let's discuss what are the side effects of them. So actually they are sedatives causing the sleepiness. They can cause drug dependence when the patient take that drug in high dose. Second, they can cause constipation, fatigue, and dysphoria. Dysphoria means the disturbance in the feeling of that particular patient. So what are the contraindication of codeine? Contraindication are pregnancy and lactation. So you should not give codeine to a particular patient in the pregnancy or lactation, because they can go towards the fetus and then cause adverse effect on him. So we have covered that what are the actions of opioid drugs, and what are they are doing, what is the mechanism of them, and what are the adverse effect of them. So due to their adverse effect, we are going to discuss about the non opioid drugs which don't cause sedative action to the patient. So the most important non-opioid drug is the dextromethorphan. So it is mostly used because it has no sedative action. It is also a synthetic derivative of morphine. It is also derived from morphine, but it has no sedative action. Mean it doesn't cause dizziness to that patient and doesn't cause the drug dependence to him. So we can give dextromethorphan to the patients, but there is that the patient the doctor should not give dextromethorphan to the children. So they should give dextromethorphan to the adults because they can cause in the low dose it is good, but when the dose increases it can cause dysphoria, mean disturbance of the feeling. So sometimes the feelings are so disturbed that the child cannot bear, so that therefore we cannot give these drugs to the child but can give to the adults because they can bear that. So this was all about the non-opioid drugs. Now we have covered all the drugs which are acting peripherally and as well as all the drugs which are acting centrally. So centrally again divided into opioid and non-opioid drugs. So we have discussed what are the opioid drugs, what are the non-opioid drugs. Now we are going towards the drugs which can act both, which also has some effect on the central areas of our brain, can also affect on the peripheral areas of our body. So what are these drugs? So the most important drug which can act centrally as well as peripherally is the benzonate. What is benzonate and what is the mechanism of it? Here I have give the mechanism that it blocks the stretch receptors. What are the stretch receptors? These are some chemical receptors or some mechanical receptors are present. Where they are present, actually you know that when a cough causing agents enter into your respiratory system. Let's suppose I am drawing here that this is your nasal cavity, and after nasal cavity the agent goes in your trachea or in your larynx and pharynx. So this is the cough causing agent, it could be anything. It goes here. Now at this wall there's various kind of stress receptors are present, like suppose I am drawing here, this is the stress receptor. So they can detect that a particular foreign substance or a bacteria enters. Now what is going to happen, they will send a signal toward the brain. Let's suppose here it is a brain. So they will send a signal towards the brain, and which is sending signals. This is the vagus nerve. Okay, so vagus is the cranial nerve number 10. So it will send signals to your brain, and inside your brain cuff centers are present. So actually it is sending signals to the cuff centers, and when the centers signals goes to cuff center, then the cuff center activates and they will cause cuffing. So actually, what is the action of benzonate? Benzonate will block these receptor. When you give benzonate to that patient, the drugs, like suppose the drug is here, the drug will go and they will block this receptor. Now this receptor cannot send signals to brain. Okay, I am raising this signal. Now the brain take no signal, no cough will happens. So this was the action of benzonate, but it has some side effect, like it can cause dizziness to that patient. It can react with the oral mucosa. If you take the drug orally, so they can react with the oral mucosa and causing a lot of reactions. So we cannot give that drug orally. Okay, but they can cause numbness of your tongue, mouth and throat. So these are some side effect of benzonate. So therefore we are not preferably use it. The most important drug which we are using in the cough syrups is the dextromethorphan. Okay, now we have covered about the antitussive drugs. All we have discussed the classification of it. Now the second type of anti-cough agent is the expectorant. Now let's discuss what is a expectorant.